Chemotherapy medications help destroy cancer cells in your body. They can also affect your normal, healthy cells, and they can affect the normal, healthy cells of anyone.
Chemotherapy is one of the most talked about cancer treatments in the world. Yet it is also one of the most misunderstood. Many people hear the word chemotherapy and immediately think of suffering, fear, or loss. But what chemotherapy actually does inside the body is far more complex, and in many ways, far more fascinating than most people realize. If you or someone you love has been diagnosed with cancer, you may be asking questions like, what exactly happens when chemotherapy enters the body? Why does it help some patients more than others? And why does it cause side effects that seem to affect the entire body, not just the cancer? Today, medical experts help us understand the science behind chemotherapy in a clear, calm, and honest way. And understanding how chemotherapy works can reduce fear, improve communication with doctors, and help patients feel more informed and empowered during treatment. This video is not about promises or miracles. It is about science, clarity, and knowledge. Because knowledge matters. What chemotherapy really is. Chemotherapy is a group of medications designed to destroy cancer cells or stop them from dividing. Cancer cells grow and divide much more rapidly than most normal cells in the body. Chemotherapy takes advantage of this difference by targeting processes that fast-growing cells rely on to survive. However, cancer cells are not the only cells that divide quickly. Some healthy cells, such as those in the bone marrow, digestive tract, hair follicles, and skin, also divide rapidly. This is one of the reasons chemotherapy can affect multiple systems in the body. It is important to understand that chemotherapy is not a single drug. There are dozens of chemotherapy medications, and each one works slightly differently. Some damage the DNA inside cancer cells. Others interfere with the machinery cells used to divide. Some prevent cancer cells from repairing themselves after damage. Doctors carefully choose chemotherapy drugs based on the type of cancer, its stage, and the biology of the tumor. What happens when chemotherapy enters the body? When chemotherapy is administered, whether through an IV, injection, pill, or infusion, it enters the bloodstream and travels throughout the body. This is why chemotherapy is known as a systemic treatment. Unlike surgery or radiation, which target specific areas, chemotherapy can reach cancer cells wherever they may be hiding. Once in the bloodstream, chemotherapy drugs circulate and enter cells that are actively dividing. Cancer cells, which are constantly trying to replicate, are especially vulnerable. When chemotherapy disrupts their ability to divide or repair damage, many of these cells die. At the same time, some healthy cells are temporarily affected. This is not because chemotherapy cannot tell the difference between cancer and healthy tissue, but because both types of cells may share similar growth patterns. The body's response to this temporary disruption is what causes many of the well-known side effects of chemotherapy. Why chemotherapy affects each person differently. No two cancers are exactly the same, and no two bodies respond to chemotherapy in exactly the same way. Medical experts emphasize that cancer is not a single disease, but a collection of more than 200 different diseases, each with unique genetic and biological characteristics. Even within one tumor, there may be multiple subtypes of cancer cells. Some cells may be more sensitive to chemotherapy, while others are more resistant. This is one reason a tumor may shrink significantly, but not disappear completely. A person's overall health, age, genetics, immune system strength, and liver and kidney function all influence how chemotherapy is processed and tolerated. This is why treatment plans are highly individualized and why doctors constantly monitor patients during therapy. How chemotherapy affects the bone marrow. One of the most important areas affected by chemotherapy is the bone marrow. Bone marrow is responsible for producing red blood cells, white blood cells, and platelets. These cells are essential for oxygen delivery, immune defense, and blood clotting. Chemotherapy can temporarily reduce bone marrow activity. When white blood cell levels drop, patients may become more susceptible to infections. When red blood cell levels decrease, fatigue and weakness may occur. Low platelet levels can increase the risk of bruising or bleeding. Doctors closely monitor blood counts throughout treatment. In many cases, the bone marrow recovers between chemotherapy cycles. Growth factors, dose adjustments, or treatment delays may be used to protect patient safety while maintaining effectiveness. The immune system and chemotherapy. Chemotherapy can weaken the immune system temporarily, but it does not permanently destroy it. The immune system is remarkably resilient. After treatment pauses or ends, immune cells often recover and return to normal levels. Interestingly, some chemotherapy drugs may actually help the immune system recognize cancer cells more effectively. In recent years, chemotherapy has been combined with immunotherapy, which helps the immune system target cancer more precisely. Medical experts stress that protecting immune health during chemotherapy is a balance. Preventing infections, maintaining nutrition, managing stress, and following medical guidance all play important roles in supporting immune recovery. How chemotherapy affects the digestive system. Cells lining the digestive tract also divide rapidly, making them sensitive to chemotherapy. This can lead to symptoms such as nausea, vomiting, diarrhea, constipation, mouth sores, or changes in appetite. Modern anti-nausea medications have dramatically improved the chemotherapy experience compared to decades ago. Many patients today experience far less nausea than expected. Nutrition specialists often work alongside oncologists to help patients maintain adequate intake and manage digestive symptoms. Hydration, gentle foods, and individualized dietary adjustments are important tools for managing digestive side effects. These effects are usually temporary and improve once treatment cycles are completed. One of the most common side effects. Cancer-related fatigue is different from ordinary tiredness. It can feel overwhelming and may not improve with rest alone. Some chemotherapy drugs can affect nerves, leading to a condition known as chemotherapy-induced peripheral neuropathy. Symptoms may include tingling, numbness, or sensitivity in the hands and feet. Doctors monitor these symptoms carefully. Adjusting doses or changing medications can reduce long-term effects. In many cases, nerve symptoms improve gradually after treatment ends, though recovery may take time. Ongoing research continues to improve strategies for preventing and managing nerve-related side effects. Why chemotherapy is given in cycles. Chemotherapy is rarely given continuously. Instead, it is delivered in cycles, followed by rest periods. These breaks allow healthy cells time to recover, while still targeting cancer cells effectively. Cancer cells often have difficulty repairing damage, while normal cells are better equipped to recover. This difference is what allows chemotherapy to work, while minimizing long-term harm. Cycle length and number depend on cancer type, treatment goals, and individual tolerance. The role of precision medicine. Modern oncology increasingly uses genomic testing to understand the specific characteristics of a tumor. By analyzing cancer DNA, doctors can identify which treatments are most likely to work and which may be unnecessary. This approach, known as precision medicine, allows chemotherapy to be used more strategically. Some patients may receive lower doses, shorter courses, or alternative therapies based on their tumor profile. Precision medicine represents one of the most hopeful advances in cancer care today. Integrative care. During chemotherapy. Many cancer centers now combine conventional treatments with supportive therapies such as nutrition counseling, stress management, gentle movement, and mind-body practices. These approaches do not replace chemotherapy, but they can improve quality of life, reduce symptom burden, and support emotional well-being. Treating the whole person, not just the tumor, is increasingly recognized as essential. Managing pain, anxiety, sleep disturbances, and emotional stress is a critical part of modern cancer care. Hope and realistic expectations. Chemotherapy is not easy, but it is also not static. Treatment protocols today are safer, more targeted, and more personalized than ever before. Many patients continue working, caring for families, and living meaningful lives during treatment. Medical experts emphasize that asking questions, staying informed, and maintaining open communication with healthcare teams can make a significant difference in outcomes and experience. Understanding how the body responds to chemotherapy helps replace fear with clarity. A cancer diagnosis can feel overwhelming, but knowledge can be grounding. Chemotherapy is not punishment. It is a medical tool, one that continues to evolve as science advances. The body is not passive during chemotherapy. It responds, adapts, repairs, and recovers. And doctors today have more tools than ever to guide that process safely and effectively. If this video helped you understand chemotherapy more clearly, please consider supporting our channel. We create science-based, compassionate cancer education designed to inform, comfort, and empower patients and families. Subscribe to the channel for more expert-led explanations, real medical insights, and calming educational content.